Good afternoon, everyone. Thanks for joining us on the County Briefing today. We're going to get started with our questions for Dr. Moreno. I see that he is on the call. And Dr. Moreno, do you have any presentation that you want to make, or do you want to just go ahead and take questions today?
Hey, good morning, Mayor. I'll just take questions today.
Okay, super. So I've got some questions that were sent in advance, and I'm going to start with those. If there are questions for Dr. Moreno, if you could go ahead and put those in, any other questions, go ahead and put those in chat. That would be great. All right, so Dr. Moreno, our first question, what is the booster shot situation? Pharmacies are offering them to approved populations at the federal level, but are they offered at county sites?
Yeah, okay, Mayor. So the booster shot is approved for certain individuals. And again, I can only speak for public health clinics. Our public health clinics can be accessed through by the public through My Turn. And an individual that goes into My Turn to find one of our upcoming clinics and schedule an appointment can sign up for a booster shot. And we have been giving boosters using the Pfizer vaccine at our public health clinics.
All right, thank you. So are you recommending that people, if they're looking for the booster shot, to go ahead and use My Turn or talk to their local pharmacy or perhaps their healthcare provider?
I don't know that much has changed in terms of that recommendation. I think we always have, and we continue to recommend that anyone looking for a first series, third dose, or booster, go to My Turn to see what's available. They can also go to pharmacy websites to schedule appointments. They can look for appointments by health participating hospitals who are vaccine providers. They can call their primary care provider to see if they're providing shots. There's a variety of different ways that individuals can access vaccine clinics. And I recommend that individuals, I still recommend people do what we've been doing for a while, which is take advantage of any one of the opportunities that are out there. And if people have additional questions about getting appointments, to make use of Monterey County 211 to answer questions and possibly provide some assistance.
Thank you. And our colleagues over at Natividad want to remind everyone that Natividad is offering the Pfizer booster shot during their Wednesday clinics. So that's from 2 to 4 o'clock. And a reminder that appointments are needed for that booster shot. And you can find those on myturn.ca.gov. So another question for you, also in regards to the booster shot, is the Pfizer booster shot required for all healthcare workers who took the first round of the Pfizer vaccine?
Mayor, I'm unaware of any updates to the state health officer's order requiring that certain individuals in certain healthcare settings receive a vaccine or acquire an exemption and test. So I don't think there's any changes to that. And that latest version just requires that individuals receive and complete the 2-dose series or 1-dose series. I think it was by September 30th, or have an approved exemption. And I haven't seen any updates that would have added a booster as a requirement. However, that's just a state health officer order. My suggestion would be anyone who's in healthcare should check with their employer to see if their employer is requiring anything more than the state health officer order.
Thank you. Another question for you. More than 200 inmates at the Monterey County Jail were vaccinated yesterday. Is this part of the overall effort to control the outbreak in the jail? And how are efforts going to control the spread there?
What I can speak to is how we're assisting. I think the sheriff's staff could answer the question on how things are going. But in terms of public health's role in outbreaks, in general, once we're aware of an outbreak, we work with the leadership in the organization, in this case, the jail, to provide assistance and recommendations, and to remind the organization of the existing guidance from the state of California, and as appropriate, CDC on ways to limit the spread of further spread of in this case, COVID-19. So we've provided updated the jail staff on the recommendations for frequent hand washing, recommendations for quarantine and isolation of individuals who have been exposed or who have COVID-19. We've also updated them and reminded them of the signs and symptoms of COVID-19 so they can identify individuals who have present early or individuals that who are in quarantine who are developing the first signs of an infection. We've also recommended, in accordance with California Department of Public Health, testing on a regular basis. This is diagnostic screening testing, which is a strategy that tests people who don't have symptoms but are at risk of exposure because of a high numbers of cases in a facility like the jail. And the effort there is to pick up individuals who may or may not be in quarantine, but have been exposed, and find those individuals with early disease or asymptomatic disease and get them isolated so they don't unknowingly expose other individuals. And we've also, and so getting to the first part of that question, vaccinations have been identified by California Department of Public Health as a strategy to try to not so much decrease the number of cases in the outbreak, but to take advantage of the opportunity and that opportunity is a heightened awareness among the population there, which would be inmates. They're very aware of the increased number of cases. They're aware of people going to the hospital. And at that moment, inmates may be more willing to accept a vaccine where they otherwise would have been a little more hesitant. So we take advantage of the opportunity. We go in and we offer the vaccine to individuals who have not been vaccinated. And that would include individuals who are in quarantine but have no symptoms. We'll go ahead and vaccinate those individuals as well to try to get as many people vaccinated as possible. The impact of all of those layers of prevention and intervention, as well as treatment, which is getting people over to a clinician to get treated with monoclonal antibodies if they have COVID-19 and meet the criteria. All of those are combined should be assist in slowing this, decreasing the number of cases of COVID-19 at the jail. And yes, we had 225 vaccinations occur, and those were all provided by public health nurses and public health staff.
Thank you, Dr. Moreno. Another question for you. Are you encouraged by the continuing decline of case rates per 100,000 in Monterey County?
Yeah, I think there's a lot of efforts going on throughout the county. We still have a state mandate that people who have not been vaccinated need to wear or must wear face coverings indoors, and we have businesses and other organizations doing their best to promote face coverings. I still recommend face coverings for people whether they're vaccinated or not. But also there's still efforts community-wide to maintain some social distancing, physical distancing. We still have people using hand sanitizers, washing their hands frequently, and a variety of efforts to get both from us, from other vaccine providers, and nonprofits and people in the community to get more people, make more people or assist people in becoming more aware of the evidence behind the effectiveness of COVID-19 vaccines and the safety of those vaccinations to get more people vaccinated, which can altogether again lead to a decrease in transmission of the virus in our community. So as long as we continue along these combined strategies community-wide, we can certainly hope that the case rates will continue to decline, which is definitely a good sign.
Thank you. Another question, what are the current case rate and test positivity numbers? Do they continue to trend downward or have they plateaued?
So the most recent, or the test positivity rate that as of Monday was in Monterey County was 3.3. So 3% of, or let me back it up, if for every 100 tests that are performed in Monterey County, 3 of them are positive. So that's stable, but it's definitely, the overall trend seems to be decreasing, and it's decreasing statewide. The case, the case rate compared to last week increased a little bit, but overall looking at the trends, which is really what we're really most interested in, not so much the day-to-day or 1 week to next, we're really looking at the trends over the longer period of time, the overall trend for case rate in Monterey County is decreasing, and it's decreasing in the region, it's decreasing according to our state epidemiologist, it's decreasing statewide as well.
Thank you. That's all the questions that I have for Dr. Moreno in chat right now. Are there any other additional questions before he drops out of the briefing and we move on? I'm going to give it usually I say I'm leaving and then a question pops up. So I'm going to give it another beat. And that appears to be all the questions that I have for you today, Dr. Moreno. Thanks very much for joining us at briefing, and we'll see you next week.
Okay, my pleasure. Bye.
Bye-bye. And now we're very pleased to have Monterey County Supervisor Wendy Root Askew joining the briefing today. She's here to talk with us a little bit more about the county's mask mandate that got final approval yesterday at the Board of Supervisors meeting. Good afternoon, Supervisor.
Hello, thank you so much for having me join you all today.
You look like you're in a beautiful location, obviously not inside the office.
We are celebrating dozens and dozens and hundreds of local statewide county supervisors here at the Rural Counties Representatives Council in downtown Monterey. So pleased to be out and about watching many visitors return back to downtown Monterey.
So I'm hoping that you'll share your thoughts on the briefing today about the mandate. It took a long circuitous route towards approval. And I'm wondering if you would just give us your thoughts on the genesis for the mandate and what your expectations are for it.
Yeah, I want to start by saying that I'm just so incredibly proud of Monterey County for coming together the way that our business, our nonprofits, our residents, our employees have all really rallied to get testing and vaccination rates, to focus on getting testing and vaccination available and to have people participate in that. Our vaccination rates are looking, phenomenal when you compare them across the state and the country. And we've fought really hard to keep testing available as well for community members who want to continue to get access to testing. The third piece of the puzzle that we know has positive impacts on keeping our kids in school and keeping our businesses open is when we have circumstances of high spread of COVID in the community, to continue masking when people are indoors or in spaces where they may be sharing close proximity to others. And so the Board of Supervisors, and I'm sure everyone's followed the process that we went through, but just yesterday we voted on our second reading to approve indoor mask ordinance that will apply to all indoor spaces throughout the county, including all of our 12 cities. This ordinance is tied, thanks to feedback from the public and questions from the public. This ordinance the language was amended from how it originally started to be tied to data-driven factors. With the consultation from the health department, we selected the CDC transmission guidelines to be the trigger that would cause this ordinance to go into effect. So the ordinance, because it's a regular ordinance, it wasn't an urgency ordinance. It'll take 30 days from yesterday's vote until it becomes effective, and it will only trigger into effect requiring indoor masking if we are in the CDC high or substantial transmission tiers.
Thanks very much for that overview. I did have one question in advance for you, and then if anyone has questions for Supervisor Askew, now would be the time to go ahead and put them in chat and I can read them out. The one question that I did get in advance about the mandate was how the mask ordinance is going to be enforced. And I have some information on that, and I can double team this with you.
Yeah, so there are specific, and I don't have the specific language of enforcement in front of me, but so I'll rely on you, Mia, to share exactly what the ordinance states. But we're not looking to criminalize anyone. We're really looking at the intent of this ordinance is to keep Monterey County healthy, is to keep Monterey County safe, is to reduce and limit the transmission of COVID so that we can keep our businesses open, so that we can keep our children in schools, so that we can continue to move forward towards recovery, where people can continue to earn employment, and we can continue operating as normally as possible. So the intent of the ordinance is really to create a culture behind safe, healthy practices, continuing to get tested, continuing to get vaccinated, and wear masks when you're indoors during periods of high transmission.
And I've got that data, the violation amounts for you. So this is very similar to the last mask ordinance that we had in place when it was in place. So it's first, second, and third violations, $100, $200, and $500 fines, and these are administrative fines for people who don't for noncompliance. I have another question for you, but it is not actually about the mandate. It is about the employee vaccination effort at the county. So the deadline is this week for county employees to show proof of vaccination. Do you have any message to those employees who are not yet or refusing the vaccine? I'll start with, it's kind of a two-part question. I'll take the first one.
Yeah, well, I do want to say that I'm just, again, so incredibly proud of Monterey County workforce for continuing to show up and serve our community during the pandemic before vaccines were available, and for continuing to show up and serve our community at a time when many county services are desperately needed. We voted in July to put in place a vaccine requirement for county employees. It was announced yesterday by our CAO, Charles McKee, that he's taken action to extend the deadline by 30 days so that we can continue making progress, getting all of our employees vaccinated. We're doing extensive outreach. We're doing a lot of answering of questions. And we do have many, and I'm going to rely on you. I don't want to put out a number. I have a number in my head, but I don't want to be misquoted on the exact percentage of county employees who have already taken steps to get vaccinated or in process currently of getting vaccinated. But I'm really proud of all of the commitment that Monterey County workforce has to ensure that we're also doing our part to limit the spread of COVID and provide our services to the community in a way that is as safe as possible to protect both our colleagues in the workforce as well as the public that we serve. But I'll rely on you, Maya, for the actual data on what the actual workforce percentage vaccinated is, if you have that with you.
I do have it. And at this point, we are 85% vaccinated of our county employees. And we also get questions about exemptions. And I have that data too. So there have been 228 exemption applications, and 108 of those exemption applications have been approved. So that answers those questions in advance. And then the second part of this original question regarding the employee vaccine requirement, have we nailed down what, if any, disciplinary action employees will face if they refuse to get vaccinated or get an exemption?
Yeah, so I think the intent of the vaccine requirement is really truly to support ensuring that we have a workplace that is safe for employees to come to work, and that we have a workforce that is able to safely provide services to the community. The specifics around disciplinary action are not, I don't believe we've come out publicly with anything, and I would defer back to Charles McKee for those kinds of questions. But I can speak on behalf of myself and my colleagues on the board, and I think really we share a commitment to keeping Monterey County healthy, keeping Monterey County safe, keeping our schools open, and keeping our businesses in recovery.
Well, and the extension shows just the commitment that the county is making to get all employees vaccinated versus take some other alternative action that we really don't want to take within our workforce. I did get this question earlier this week, and it is important to note that each situation of an employee who might not be vaccinated could be completely different, and they would be addressed, those situations would be addressed appropriately, including through processes that are currently in place with our labor agreements, and that's important important for people to know. Staff which have not complied could face disciplinary action, including termination. It's important to know, though, that that kind of action is a personnel matter and not something that it is usually information is released about. But again, the point is to get people vaccinated or exemptions versus the alternative action. I have another question for you, Supervisor. Ask you, how can Monterey County be sure the level of transmission reported by the CDC is correct when a few weeks ago it was reportedly incorrect due to a lack of reporting from the state?
I think that's a really good question. And I think the struggle that we've had with data systems that for public health, we've experienced that struggle from day one, trying to understand exactly what our current transmission levels were, what our hospitalization levels were, the demographics of where COVID is being impacting communities most. So specific to the CDC question, one of the factors that we did include in the ordinance to account for some of the variations in data reporting and the transmission of data from the local level to the state and to the federal government level. Once the mask ordinance triggers into effect, it will remain in effect for 30 days. So that should account for some of the variations in the CDC reported transmission levels. So even if we're bouncing up and down, once we trigger into effect, we would remain in the mask requirement for indoor masking would remain in effect for 30 days. So even if we're fluctuating, the intent again is to keep the county safe, is to keep the community healthy, and to allow for some stabilization of transmission rates.
And then I have another question about the vaccine extension from yesterday. Was that a decision made at the administrative level by the CAO? And what was the extension date? And I'm assuming that extension is October 30th or October 31st?
Correct. That was announced yesterday at the end of our meeting by our CAO, Charles McKee, as part of his board comments. And it was within his authority that was granted to him during state of emergency.
And the date is October 30th or 31st?
I would have to defer back to the specifics of Charles's comments yesterday.
I can get that. Okay, I didn't know if you knew it off the top of your head, like you know everything off the top of your head, right?
I think it's the 31st, but again, I would want to just be verify that that's correct.
All right, thank you.
Yeah.
Are there any other questions for Supervisor Askew before she has to go back and sit in the sunshine without a pair of headphones on?
And I'll just add one more point. I really want to thank our business community for standing up to support the mask ordinance. We worked in partnership with one of the factors that took us a little bit longer to get everything finalized was because we were open and listening to community feedback as we took steps to put this policy into place. And we did hear from those who are hosting large conferences about some of the ways in which the ordinance could be amended to better support and accommodate the specific and unique needs of large groups that are coming back into our county, generating TOT and bringing businesses, helping our businesses stay open and remain open. One of those exceptions that was made was in instances where groups can show proof of vaccination, they are not required to wear a mask indoors when the ordinance is in effect. Those who cannot show proof of vaccination would be required to wear a mask. And so that is going to be a burden on some of our hospitality folks who are hosting large conferences, but it was a burden that they're welcoming and working in partnership with the county to help make sure that as we bring businesses back up and running, as we welcome tourists back into as an economic driver for Monterey County, we're working in partnership. The Board of Supervisors has shown a commitment to listen and coordinate, and our business community, I'm just really thankful and grateful that they've also been so clear in their communication about what they need as well to keep our community healthy and to keep our community safe. So hopefully we'll be in low transmission rates. We're decreasing the rate of transmission right now, and hopefully we remain in those lower CDC transmission rates moving forward. But in the event that for some reason that's not the case, we do now have this ordinance in effect as just one more measure to help keep transmission rates low in Monterey County.
Thank you very much, Supervisor, for joining us on the fly, as it were, from your meeting, and have a beautiful rest of the day out there.
Yeah, thank you. And thank you all for just helping to get the facts out into the community. This is important, the work that you're doing. So appreciate it. Thank you.
All right, let's move on to our next topic. There has been a lot in the news recently that the eviction moratorium that has been in place for some time is ending at the end of September. However, assistance is still available for people who are having difficulty with their rent and also with paying their utilities. And we're very pleased to have Katie Castagna and Kelly DeWolf from the United Way back with us today to give us an update on the Rent and Utility Assistance Program, which has just done a wonderful job in providing assistance to people who are really in dire straits. Good afternoon, ladies.
Good afternoon. Thank you for inviting us back. Kelly and I are here today to provide a brief update and sort of a status of the activities so far and the accomplishments of the Rent and Utility Assistance Program. And then just to provide some updates, because we know that there is a lot of growing concern about the end of the eviction moratorium. And so we want to make sure people understand that there is still help available and how to obtain it. So I'm going to ask Kelly, thank you. I'm going to share the screen. Thank you so much. So just as a reminder, United Way is working with the County of Monterey as well as multiple community-based organizations to help distribute $28 million in emergency rental assistance, which also applies for utilities, to low-income residents who have had an economic impact from COVID. And that could be that they were ill with COVID-19 themselves, or perhaps they lost work and wages because of the pandemic. And it provides pretty extensive assistance for back rent as well as some current rent and as well as utility assistance. So this is a heavy lift. We know there's a lot of need out there. And I want to start with some good news, showing and sharing with you how much distributed to date. And so top line so far, and this is really numbers through early September, we have paid out over $8.8 million in rental assistance. And that's for the most part paid directly to the landlord. In some cases, it's paid to the tenant if the landlord is unavailable or uncooperative. And then we've paid 1.4 million plus in utility assistance during that time. And that's from the start of the program in March through September 7th. So a total of $10.2 million is out the door, but we've obligated really the full amount of that $28 million allocation to Monterey County in the form of people who have applied and who have have applications in the pipeline. Total households assisted to date for rent itself is 1,660 households. And then the utility assistance has been provided to 824 households. And remember that households are eligible in many cases to apply for both. So there may be some overlap, and we know that households have been able to benefit from both rent and utilities. So we're really pleased with the ability of our partners to have assisted so many households to date. And we also acknowledge that there are many others who are still waiting and in the process. And so I'm going to turn this over to Kelly to talk about some of the things we've been doing to build capacity, and then also some of the late breaking information related to legal concerns around eviction.
Thank you, Katie. So on this next slide here, we do have a few different visuals of the remainder funding versus spent funds. The first side here, we do have showing our total amount spent in the dark blue and the remaining funds to be spent in order to meet our full ERAP 1 allocation. As you can see in the second part here, we do have the amount spent and then the amount in process, which is what Katie referred to as the obligated amount. So it's the sum of the amount owed in outstanding applications. So as you can see, we have obligated more than what we have in our first ERAP 1 allocation, but we do also have ERAP 2 that we can tap into to cover those additional households. And we expect that number to continue to grow. So we will have additional funding for folks who have not yet applied or who need help assistance with future rent. So that's just kind of an overview. By agency, we also have our spending broken down here. Our largest spending agencies are Hartnell College Foundation and City of Salinas, as well as Goodwill, Central Coast, and Salvation Army. These are our partner agencies who are serving all zip codes, and the City of Salinas is seeing the largest need in the city. We have pretty much the same breakdown for utility assistance in terms of geography, and we have our partner Central Coast Energy Services, who is leading with the most expended for utility assistance, and they are also serving the whole county for utility assistance. So a couple of things I wanted to mention. One is the eviction moratorium. I'm sure all of you know that tomorrow, September 30th, is the end of the eviction moratorium in Monterey County in the state of California. We have created an online portal where tenants or landlords can actually view application statuses and information about completed applications online at mcrenthelp.com. This is an online portal that allows you to place your application ID number, address, and zip code and pull up your application status if you have already applied to the program. According to AB 832, tenants' best protection against eviction right now is to have an open application for emergency rental assistance through our program. If somebody has applied before the 30th and they can prove that they do have an open application, even if they have not been paid yet from our program, they are still protected from eviction until the end of March of 2022. So that's really important for people to know that they can look up that status and print it out online if they need to at mcrenthelp.com. We also have been collaborating with the Monterey County Court. We're going to provide the Monterey County Court with access to our database as well so that they can look up cases. And we are working with our partners at the Watsonville Law Center to provide legal support to our applicants. Another question that we commonly get is why we have not yet spent the full allocation. We've been in this program for about 6 months so far. And as Katie mentioned, it has been a really heavy lift. Our program has expended close to 11 million according to what we've presented for you today, but since that is through early September, as Katie mentioned, my best guess is that we are closer to 13 million at this point. And our partners report that the number one delay in getting those applications across the finish line is insufficient documentation. So what we would really recommend to applicants is getting in touch with the agency that they're working with as soon as possible to provide that documentation and move their application along. Because MCERAP requires such a heavy amount of case management, it is a very heavy lift for our agencies, each who have hundreds or in some case more applications to work with, and often are working with some of the most vulnerable residents in Monterey County. So we are moving through them as quickly as possible, but we have been working to expand capacity and reduce the caseload of each staff member working on the program. So the way that we have done that is through partnering with some of our grassroots agencies across the county. So we've been working with Mujeres en Acción to provide support to our partner agencies through the community health workers who are able to help applicants navigate the documentation process for this program. We have also partnered up with COPA, and COPA has provided in-person events where applicants can apply and submit all their documentation on the site, which expedites the application process for those individuals. We have also been working with the Housing Resource Center to provide a place where landlords can apply online and receive assistance for all of their tenants who are past due. And that has really expedited assistance for many of our residents as well. In addition to these partnerships, we also are working on a communications technology through our software that will allow us to send texts to applicants. And we have worked to streamline our application process so that folks who are applying do not need to submit as much documentation and can use self-attestation forms where it is up to compliance with the state and federal government. And I believe that is all our updates. We do have more information about the program in general, and this is kind of a list here of all of our partner agencies that we are working with on this program.
Thank you very much, Kelly. I do want to, Kelly, are you going to toss it back to Katie? Or should we ask for questions?
I think we can take questions. Katie, unless you have something else.
I just want to summarize that people can find the latest information on the United Way website, unitedwaymcca.org, as well as on the applications site, mcrenthelp.org. People can have that find that lookup feature for their own application status. And just know that as more information becomes available, we're always updating the resources there. And so with that, we can take questions. Thank you.
Thank you. And thank you very much for putting those web links in the chat. And if there are questions for Katie or Kelly, this would be the time to go ahead and put them in chat. I do want to ask you, Katie, I know for a while people were concerned that there were delays and whether they should go ahead and apply or not. What do you want to tell people about, should you worry that there are delays? Should they just go ahead and apply anyway?
Definitely apply. We've continued a steady stream of applications, 200, 250 a week, let's say. And whether there's a delay or not, in fact, because of the delay, having an open application, as Kelly mentioned, is one of the important protections that provides a little bit of grace period in the eviction process. So people can apply online directly, or they could call 211 to open an application.
Thank you. And I do have a question for you. Is there an expected increase, and I'm assuming by increase in applications, now that the moratorium is ending?
We're having an increase in phone calls and inquiries about the program and about application status, but as far as the numbers of applications, it's been pretty steady in that 200, 250 a week in recent weeks.
So another question for you. What happens if a tenant applies after the moratorium ends? Does that make a difference?
So it does not make a difference in terms of their eligibility for benefits through our program. It makes a difference though in terms of their legal protections. If they do not have an open application prior to September 30th, they don't benefit from that grace period through March of 2022. However, we still have funding available, and we still do encourage people to apply if they need assistance, because they can still receive those benefits even if they apply after tomorrow.
Thank you. That's all the questions that I have in chat for Kelly and Katie. Are there any final questions before we let them go and move on to our last topic? Seeing none, thank you both very much for bringing, I mean, it's great to see that the program is moving forward, that applications are still coming in, and that there's still help available. Thank you both for joining us.
Thank you so much.
Thank you.
And then our last topic is about our local seniors. And I'm very pleased to have Teresa Sullivan, the Executive Director of Alliance on Aging, on the briefing today to talk about an interesting program that the Alliance has, which is a senior peer counseling program, but also a little bit about how COVID has impacted seniors during the pandemic. Good afternoon, Teresa. And you're muted. You got to click that mute button.
Thank you, Maya.
Gotcha. Oh, you're muted again. You're muted again.
How about now? We're
Perfect.
good?
I hear
Okay.
you.
All right. Just had to say, I remember you when, Maya, you were,
That must have been when you were in high school.
I don't remember, probably, but I do remember you well. So it's nice to see you again. It's been a long time. So quickly, AOA, Alliance on Aging, has been providing services for older adults for the last 50 plus years, actually, here in Monterey County. We currently have 6 core programs. I'm going to focus today on the mental health program that we call Senior Peer Counseling. And Senior Peer Counseling is, about 18 years old. So it's pretty well established in the county. We have 29 volunteer counselors that provide emotional support and counseling for seniors who are dealing with the many losses of aging and the depression and anxiety that often accompanies that. And these include loss of family, spouse, friends, careers, jobs, independence, declining health, impairment in hearing, vision, and mobility, family conflicts, seniors living with adult children or grandchildren, either in their own homes or in their children's homes, seniors raising grandchildren, supporting adult children in crises, and just generally increased isolation. So there's a lot. Aging is clearly not for sissies, as they say. So COVID brought a whole nother level of uncertainty, fear, and anxiety to their lives. We received a huge volume of calls early on during the COVID pandemic. Seniors did realize that they were at the greatest risk if they contacted COVID, and were generally very fearful about it. They were alone in their homes, watching a lot of TV, feeling pretty overwhelmed and confused with the media coverage and the information about COVID. They didn't really understand what shelter in place meant. Many didn't understand. They asked us if they could go out in their backyard, take out the trash, visit with their neighbors, see their grandchildren. Some expressed concern that their children were being too cautious and not visiting them. Others felt the children weren't being careful enough. They were concerned about where to get their groceries, their prescriptions, how to get a COVID test if they thought they might have been exposed. They were isolated from their family, friends, neighbors, their social networks, daily activities, even being advised not to go to their usual medical appointments. So shelter in place happened right in the middle of the tax season. So we had begun the tax program, but we had to put it on hold until we could develop a model where we could provide the service, but not in person because of the risk of contamination. So the seniors were just generally in a panic about that, about their taxes generally in terms of getting them filed. And that's just something that always is the case. They're very, anxious to get those done and get those taken care of and get their refunds. Fortunately, the IRS extended the filing deadline. But then when the first stimulus payments were announced, the seniors then again became panicky and started becoming worried that they were not going to get that stimulus check if they had not filed the return this year or even the previous year if they didn't need to. So there was a lot of information and reassurance that we had to provide seniors just around the COVID and the shelter in place, and then the tax just complicated it. But as far as our peer counseling program, both our English and Spanish speaking peer counselors continue to do the individual counseling that they do and the support group by phone. So they were contacting folks every week, sometimes more than once a week, to do that counseling. They used video chat if that was something they were comfortable with, FaceTime, WhatsApp. And sometimes they made contact by email if they had email, just to create some frequency of connection. Some sessions lasted 5 or 10 minutes, some lasted an hour. But in general, the seniors really appreciated the calls and they wanted us to continue doing it. There were a few seniors that really wanted in-person contact. We had a few volunteers at that point that were comfortable doing that. So they would meet with them outdoors at cafes, in their backyards, on walks, keeping distance, masked, all of the protocols. The volunteers themselves have regular meetings. And so they continued to do that bi-weekly, and they did that via Zoom. Spanish-speaking counselors were not as comfortable, or they didn't have the technology to do Zoom. So they did the go-to-meeting meetings where they were just audio meetings. And these were really important for our volunteers because most of them are older too. So they were feeling really all of the same stresses as the people they were helping. So these really were important support group functions, really, that these meetings played for the volunteers. Agency-wide, we made outbound phone calls to all of the folks that we had contact information for. And again, we have 6 other programs, so we have lots of other clients we work with. So they did just regular check-in calls, see how you doing. Do you need any information? Do you need any resources? And at the end of the day, it was a lot about providing reassurance. Consistently we said, there is going to be an end to this. I don't think any of us recognized how long this was going to go on, but we just really did want to get that message out. We continue to do that. We devoted our homepage on the website all things COVID. So any information that we had about the pandemic, about testing, about groceries, prescriptions, restaurant deliveries, testing. Testing was probably where we spent the largest amount of effort in terms of keeping it up to date because we were daily making updates on who was doing testing. We produced a series of videos about dealing with the mental health impacts of COVID. We put it on our website, and it was on the Monterey County Behavioral website. We sent out care packages to who we felt were particularly vulnerable seniors with affirmation messages and fun activities. We organized a community campaign that inspired over 8,000 personalized cards to go to seniors in facilities and in their homes. We solicited games, activities, birdhouses, and books for the residents of the long-term care facilities, and we gave them to others in their home. We solicited over 5,000 homemade masks that were also distributed to seniors, again, in facilities or in their homes. So our consistent message has been to stay connected as much as they possibly can, however they can do that. And, again, we reminded them that there would be an end to all of this. So when the vaccine was finally rolled out, the first to get them were the seniors in the nursing homes and the residential care facilities. But it was a challenge for many of the seniors in their homes to navigate the online portals that were available through the healthcare systems and through the county. And so we were getting many, many calls, many frustrated seniors who really wanted to get the vaccine, who could not get through the system. So we worked for the VNA to set up clinics for those folks that could not get into the system. And so we scheduled over 2,000 vaccine appointments at 3 different sites in Salinas for those folks. And our staff actually assisted the VNA. We did some of the screening for them and the preliminary protocol tracking. And so we got to see firsthand, I was there, you know, the relief and the gratitude of these seniors. I have never seen so many people happy to get a shot. They really, really were grateful and felt a high level of, I think, relief and protection, particularly after that second shot. So we sort of had this little bit of a honeymoon period after those shots that were in March and April. And then we started hearing about the variant. So people had begun to kind of resume life, maybe not totally their normal pre-COVID life, but resuming some of the activities, although there were those that were still very cautious and were not ready to do that. And then the variant appeared on the horizon and people started getting more uncomfortable. Everyone started being more cautious, as they should be, but it really was even more so beginning to wear on everybody. It just, you know, we were telling him it was going to end, but it really felt more than ever that it really was not going to end. So, you know, that is kind of where we are at this point, is seeing how it is wearing on them, this prolonged state of uncertainty. It's wearing on our volunteers, it's wearing on our staff. I've talked with many colleagues and everyone is feeling the same sort of sense of, you know, when is this going to end? Compassion fatigue is what I actually heard from a counselor recently. And those are the folks that are in the business of delivering the service. And so, you know, we are all just trying very hard to keep our morales up, take care of ourselves. It's okay to take care of ourselves. And really, I was talking with a counselor early this morning, asking her how she was dealing with it in her private practice. She was hearing a lot of the same things that we were hearing, all of the same things. She served across the age cohort, serves a lot of older adults, but she said that she and her counselor friends get together to talk and to vent and, you know, to try to come up with some creative ways to deal with this. But at the end of the day, it's really about taking care of ourselves so that we can fuel and take care of others. And it's all about resources. You know, we just need more people to help all those folks that are in such great need. So in terms of the booster, we are ready to do exactly what we did with the vaccination. When the booster becomes available, we kind of have to wait to see what the county's going to do, where there is a gap in availability. I know VNA is ready to step in and fill that gap if that needs to happen. And so we are just, you know, we have a template in place in terms of doing those schedules. We know better what to do and how to do it. And so we are committed to, you know, expediting that process in whatever way we can. And, you know, putting it out in all of our social media, on our website, in our physical outreach, because we began in April to do outreach, in-person outreach. So we are getting the word out about all of our services, all of the services in the senior sector, so that people are aware there are services available, whether they're remote or in person. And I think Victor had a question about how many numbers in terms of the phone calls. I think I don't have the number, but I think we calculated they doubled by about 150% of what they normally are at that time of year. You know, the phone calls have leveled off since that first 3 months, but we still continue to get calls around that. But the mental health impacts are not necessarily something people call you about, and that is our concern, that our people are home, they're isolated, and they're dealing with all of these feelings. And, you know, we're trying the best we can to reach out to them with, you know, the resources that we have. I think the challenge that most of us are having in service delivery is that, we're able to reach out to those clients that we've had, but it's those newer folks that we feel we are not reaching in the way that, that we're not able to reach as effectively. And so we have really bolstered our outreach. We had a media campaign that was with the Area Agency on Aging, again, to get the word out that these services were all available and, to encourage people to call and access them.
And Teresa, Victor had another question about how many volunteers are on hand that you talk. I mean, your volunteers are amazing.
Yes.
The volume of work they're doing.
They do. We have right now, we currently have 29 volunteers in the senior peer counseling program. Overall, we have about 150 volunteers, but I have to tell you, they're older themselves. So their contributions right now are pretty much limited to remote work. Our ombudsman staff are really focused on getting back into the facilities, the long-term care facilities, now that they're able to do that. But because of the testing requirements and the potential contamination for our volunteers, they are reluctant to go into the facilities. So overall, I would say we have about 150 volunteers that do direct hands-on delivery of service. They all do very serious work. They're certified, they're registered, they're trained. They all have ongoing training. Sometimes it's twice a month, sometimes it's once a month. Right now, we're ramping up for open enrollment for Medicare for the prescription plan that begins October 15th. That is a huge initiative that goes through December 7th. It's the one time of year where you can make changes to your prescription plans. Very important to review those because it can ultimately save or cost thousands of dollars if you don't. And I think I had another chat question.
Yeah, and let me go ahead and ask the question for our people who are watching on Facebook and YouTube. Going back to the booster, you talked a little bit about being prepared for the boosters. What are you seeing in terms of your clients and the seniors that you work with of their interest? Is there a lot of demand, a little demand?
We're hearing a consistent demand, and our sense at this point is that they are very interested in getting the booster. We haven't done any surveys per se, but just in our conversations and all of our programs, they are interested in it and, are waiting basically for it to be rolled out. So I am guessing, that they are gonna access it. Again, I think we may be needed to help because there's always challenges with folks in these online portals. They don't have the tech savvy. Sometimes they just don't have access to the technology. I know they're all trying to make it easier. I know the county towards the end had a phone line so they can make phone appointments. So we're just, we're going to see how that goes and be there in the default position to help in any way that we can. And if it means a partnership with VNA and them doing the vaccination, we know how to do that.
I think there's also 211 can provide assistance for making
Yes.
appointments
Yes.
as well.
We do, yes.
A couple more questions for you, if you can stay on just a little bit longer. What are some of the issues that seniors are saying they have now in terms of the pandemic, or at least they're willing to express to you?
Well, I think they're just done. Like all of us, they're done with it. Many of them are, and they're tired of the restrictions, that are being placed on everybody. I think the face masks and the fact that there are some that are ready to go out, they're ready to resume life, absolutely as it was. But then they have friends, they have family members that aren't there, and they're more cautious. So that then impacts them, and their ability to visit and have sort of the normal activities, the normal social activities that they have. And there is a new fear. I think they all, many of them were relaxed after the vaccination, but now, again, they're a lot of them are at home, they're watching TV, they're listening. I think they're becoming more discriminating about what they're listening to. but they are concerned about the variant. And so it's like, okay, we have to go back into this, this isolation mode, or at least something that's less than what they would like to be doing. So there's, and the mental health piece of it, I just think that they are feeling like they don't have that many more years left. And, unlike some of the younger people who are also suffering from this, these folks are in some cases living out their last years. And is this how they have to live out their last years? So that's primarily what we are hearing. And, so we're just continuing to engage with them as often as we can, encourage them to engage as often as they can, as safely as they can. And, reach out, be open with their family members, be open with their friends, feel free to be able to talk about it and vent about it, try to have a sense of humor about it. And, don't get so obsessed with it and be listening to the news 24/7, or really limit the number of hours that you're listening to the news, whether it's COVID related or not. Really try to find some ways to have some fun and enjoy some of those activities that bring joy to your life.
And let me just ask you one more question. This has to do a little bit about the news. You mentioned earlier about confusion about media reports at the beginning of the pandemic. Are there any suggestions on how we can help out? And this is from a reporter.
Yeah. I think it's the sort of sensationalized version of it all. And that's probably early on more than is happening now. I think we're probably getting more accurate perspective and coverage of it. But I think the whole breaking news banner that we see on some of the, the 24-hour, 24/7 news coverage. And I think we have to be careful with our words and really carefully use those words carefully. And I know to get attention, there tends to have to be drama with that, but I think that drama has an impact on people, and particularly an impact on older adults. So I think there's got to be the reporting of the news with some level of reassurance, that's true and reality based, but just understanding that, it is a tumultuous time in our country right now. And certainly the job of the news folks is to report that news, but I think we really have to think about how that is delivered, and delivered in a way that is factual, but at the same time is where there's some level of reassurance that, we are, not a Pollyanna kind of an approach, but at the same time, people have to have reason to be hopeful. And I think this is another case where words really do matter.
Thank you very much, Teresa. Very, very well said. And that is all the questions that we have, and we're well over our time, but it was just an excellent conversation. And that will wrap up our media briefing for today. Thanks everyone for joining us. Our next briefing will be next week, and we'll see you then.
Thank you, Maya.
Thank you.